If you are going through chemotherapy, especially with drugs like taxanes or platinums, you might be dealing with a frustrating side effect, peripheral neuropathy. That is the sharp tingling, pain, or complete numbness in your hands and feet. Evidence-based techniques can actively manage or even reverse that nerve damage. Today, we are going to build a 3-step action plan you can start right now. All you need are a few things you probably already have at home: a towel, a tennis ball, some dried rice or beans, and your doctor's clearance. Following this specific checklist provides a structure for you to actively improve your nerve health every day. Let's get started with Step 1. Step 1 focuses on simple daily movements. Regular, gentle stretching relieves the physical pressure on your nerves and gets the blood circulating back into the affected areas. For your feet, you can sit down, loop a towel around your toes, and gently pull back. For your hands, basic wrist flexes, just bending your hands up and down, will keep your joints mobile. Because neuropathy causes numbness, it naturally throws off your equilibrium. Practicing heel-to-toe walking or sidestepping trains the stabilizing muscles in your legs to compensate for that loss of feeling. A numb foot is a major fall risk. You should always do these balance exercises standing right next to a wall or holding onto a sturdy chair so you can catch yourself immediately. Chemotherapy is exhausting, so do not try to force a long workout. Break these movements up into short 10-minute intervals throughout the day. Consistent, bite-sized movements restore physical function and help rebuild your confidence on your feet without overexerting a body already fatigued by treatment. Step 2 is about directly handling your symptoms at home, specifically by retraining how your nerves process physical touch. You can manually stimulate your nerves and draw blood flow to the surface through self-massage. Use coconut oil or lotion, or simply try rolling your hands and the soles of your feet over a tennis ball. We can also use a clinical concept called desensitization. By exposing your nervous system to safe, varying textures, you actively train it to reduce sensitivity. You do this by filling a bowl with dried rice, beans, or even marbles. Just bury your hands or feet inside, letting the different textures press against your skin. While you work on the outside, you need to protect the nerves on the inside. High blood sugar and excessive alcohol intake both aggravate nerve damage, so keeping those in check prevents your symptoms from getting worse. It is also helpful to practice deep breathing, yoga, or mindfulness. Lowering your stress levels reduces systemic inflammation, which lowers the severity of the pain you perceive. Combining internal inflammation control with external texture training helps stabilize your nervous system and reduce the frequency of neuropathy flares. Our third step moves beyond what you can do on your own. It is time to gather the specific clinical options you need to discuss at your next oncology appointment. This graph illustrates how certain therapies impact nerve pain over time. For instance, studies show that acupuncture is effective at reducing chemotherapy-induced nerve pain. Whole-body vibration therapy is another option for improving lymphatic drainage. Ask about at-home clinical aids too. Over-the-counter lidocaine or menthol creams offer temporary relief, and a TENS unit uses mild electrical currents to safely interrupt pain signals. Finally, write down a few nutritional supplements known to fight nerve damage. The main ones to ask about are alpha-lipoic acid, L-glutamine, and vitamins B6 and B12. High doses of B vitamins require medical supervision. You must get your doctor to clear any new supplement, as well as any prescription nerve medications like gabapentin, before taking them. Organizing these exact therapies into a list bridges the gap between managing your symptoms at home and getting targeted professional medical intervention. Here is your completed action plan. You now have a routine for daily movements, a strategy for at-home desensitization, and specific discussion topics for your doctor. Take a screenshot of this checklist right now, then pick one thing, either the towel stretch or the rice bowl technique, and try it today. When it is time for your next oncology appointment, bring this exact checklist with you to clearly advocate for your nerve health. A structured daily plan provides the tools necessary to manage chemotherapy-induced neuropathy. For more resources on supporting your body through treatment, visit humalite.com. This video is for educational purposes only and is not medical advice. Always consult your healthcare provider before changing your treatment plan.